Hey, this is Marty Stempniak, staff writer for Hospitals and Health Networks. I'm reporting from the American Hospital Association's 29th Annual Rural Healthcare Leadership Summit, and I'm joined today by Jamie Orlikoff, president of Orlikoff and Associates and a noted healthcare governance expert. Jamie, thanks so much for being with me today.
Oh, my pleasure, Marty. Thanks for having me.
Just for starters, what's the outlook for rural healthcare in 2016? What are you seeing in the field?
Challenging. With all of the trends that are going on, we're seeing rural hospitals under a lot of pressure, and the weak ones are starting to fold. We've seen about 58 to 60 rural hospitals close in the last couple of years, and about 600 of them are on kind of a watch list, at risk for closing in the future. So in general, and this is obviously a general statement, some are doing quite well. Some have already gone out of business. But in general, it's a very pressured environment for rural facilities today.
Consumerism is a trend that we're talking about a lot. Just how are you seeing rural healthcare leaders approach this trend when maybe they don't have the same resources or the tools that some of the bigger players in the field might have?
Well, it's a very challenging issue for all hospitals as we're shifting risk to the last place it can be shifted, which is the individual, the employee, the family, in the form of high copays, high deductibles, premium shares, and then also out of network. So you don't just have one copay. It depends on whether it's for a primary care visit or a specialist visit or an emergency care visit. So it's a big, big issue. But the challenge for rurals on this particular issue is it makes it much more difficult for them to do everything for everybody, to be a full-service shop. But they have to develop a retail strategy. And for rurals, probably the best strategy is to really embrace a telehealth strategy, is to take advantage of virtual visits and things of that nature. And the benefit for them of doing this is they can probably do it without a significant investment by linking into others who are already providing this type of service. But if they don't embrace this, they're going to really put themselves at even greater risk, because they run the risk of exacerbating the trend where patients with money will go elsewhere to get care, and they'll be left in non-expansion states with Medicaid and indigent patients. So it's a very serious challenge. But a good question for rural board members to consider is, number one, what's our retail strategy? And number two, hopefully a very strong component of that will be a telehealth strategy.
Something with telehealth in the past there's been some barriers to it, whether it's legislative, whether it's payment. Does it seem as if some of those barriers are starting to lift for rural hospitals to be able to?
Oh, most definitely. We're seeing the legislative challenges are dropping by the wayside, and also the markets are pushing for it. So, you can, the telehealth doesn't respect state lines. So the states like Texas try to arbitrarily limit telehealth, simply drives the business to other states. So I don't see that as a big issue. The bigger issues are fitting that into the other kind of strategic array of activities, and then the investment, and then also being able to offer the service which appeals to the various segments of the consumer market. Some will be purely price shoppers, some will be purely quality and safety shoppers, some will be convenience shoppers, and then some will be value shoppers. And so the great challenge is making themselves relevant to the individual purchasers, not just once a year, but every single time those individuals need a healthcare interaction. And that's really what I think the great risk of the whole retail environment is.
Mm-hmm. And of course, mergers and acquisitions is a big issue for rural hospitals. Do you expect the M&A activity to continue at the same clip in 2016 in the rural segment?
Yes, I think that M&A consolidation is going to continue to grow. We're starting to see not just the growth of statewide systems which dominate their states, but also the emergence of regional systems which are cutting across states. And I think this can be either a blessing or a curse for rural facilities. It gives them the opportunity, if an appropriate affiliation partner presents itself, to be able to consolidate or affiliate or pursue any of the number of different affiliation strategies to be able to maintain a local presence and local services in the community. Conversely, many rurals pride themselves on their independence, and many of them are legislatively inhibited from consolidating because they're public county district authority hospitals. Now, those organizations, if they want to affiliate, are going to have to jump through a lot of hoops to be able to convert to 501c3 status first, or do something which will make it easier to facilitate an affiliation. But the facilities which are private, standalone 501c3s who really pride themselves on independence are going to have to really look in the mirror and do a very, very dispassionate self-assessment as to whether they can make it as an independent. And that's going to involve a lot of soul searching and a lot of hard number crunching to try to determine that.
Mm-hmm. Just in closing, Jamie, any words of advice you'd leave for rural hospital leaders who are trying to figure out how to navigate the transformation that's going on in their field?
Yeah, I would say a couple things. I'd say, first of all, don't wait. You want to make a commitment to a particular strategic course of action from a position of relative strength. Many organizations basically say, well, let's just keep doing what we're doing, and seems to be working okay. And then if it changes, if we start to go into problems, then we'll look for options. And that's a very limited and limiting strategy. So I'd say, make a choice and then aggressively pursue it. Secondly, I'd say, regardless of the choice that you make, whether to go it alone, whether to seek affiliation, that some of the characteristics that are going to be critical to success are going to be a really good cost structure. So tightening up on the cost side is going to be absolutely imperative, and very, very solid quality. So that's going to be one of the key kind of drivers of success, regardless of how they choose to proceed.
Great. Jamie, thanks so much for being with me today.
My pleasure. Thanks for having me.
For H&HN, this has been Marty Stempniak. Thanks for watching.